Hi everyone, my name is Dr. Deepa Vinay Nambiar and today I'll be talking to you about cervical cancer and what we can do to prevent it because vaccination is available and it's very big a boon. Cervical cancer is the most common cancer in India and the cause of death for women, and it is seen in more developing countries, and the awareness about it and the screening about it is very less still. We should make sure that people know about it so that we can get to know the disease much more better earlier. Cervical cancer has a very big lag phase to develop, so it's around 10 to 25 years. That is why screening is very important, and when we screen, we get to know early changes of the cells in the cervix, because of which we can diagnose better, and early diagnosis is always better prognosis in this case. The risk factors that cause cervical cancer are age, very early menarche, very early exposure to sex, multiple sexual partners, a history of STDs, that is sexually transmitted diseases, a history of human papillomavirus disease, which is pretty common in everyone who's had contact. When the patient has had contact with an uncircumcised partner, the risk is a little more high. A history of smoking, the use of oral contraceptive pills for more than 5 years, immunosuppression as in genetic, autoimmune, as well as infections like HIV, and even dietary factors, which is diet in less than vitamin A, can definitely cause and have a risk for cervical cancer. Symptoms of cervical cancer can vary from patients to patients. Some of them may be totally asymptomatic and come at a very later stage of disease. Symptomatic patients can present with abnormal uterine bleeding, such as postcoital bleeding, irregular spotting. They can also have abnormal vaginal discharge, which most commonly is foul smelling. They can have cachexia, sudden loss of weight, loss of appetite. They can have problems in urination as well as defecation. And they do come probably at later stages when they are not screened. That is why screening is very important in cervical cancer. So your screening options are pap smear and liquid-based cytology, which is much more specific. A pap smear is recommended for anybody who is more than 21 years old who has had sexual contact. It is done once in 3 years, and once it comes negative in 3 years, you can continue and follow it up once in 5 years up to the age of 65, and only if indicated it is continued after 65. In case the pap smear comes abnormal, then you will have to go in for something known as a colposcopy, where we can find out at what stage the cervical cancer has progressed, and accordingly we can go in for what kind of treatment you need. The treatment usually for cervical cancer is more radical, so there is surgical involvement unless it's in a very late stage where you will have to undergo chemotherapy and radiotherapy. So when we do have options like screening and especially vaccination, the best age for administration of this vaccination is from 9 to 13 years of age. The HPV strains that actually cause cervical cancer are 6, 11, 16 and 18. So there's bivalent as well as quadrivalent vaccinations that are available. The vaccination just has 2 dosages, one at 0 month and one at 6 month. The same thing goes for post-exposure patients where they can take the vaccine, which can help prevent cervical cancer, which is caused because of many other strains of viruses, up to 40 to 45 strains, so it is definitely useful. Adults can take this vaccination at a course of 0, 2 and 6 months and can follow up for their pap smear. Studies have showed that they can 95 to 100% of the times prevent cancer, and this is a great boon to humanity. We can actually prevent a cancer and still people don't know about this vaccination. Cervical cancer that is caught in the early stages has a survival rate of up to 92% in a 5-year range, and that is a great deal. It is possible for women of all age group to develop cervical cancer, but females who range from the age of 30 to 45 are at a higher risk. So when we have such a wonderful vaccine to actually eradicate cervical cancer, please make use of it and spread the awareness.